Having good circulation is an important part of aging gracefully. The repercussions of having poor circulation are pretty drastic. In this video, I'll share a few exercises you can do now to improve your blood flow. Having poor circulation can lead to heart disease, slow wound healing, muscle cramping, pain, swelling, and a higher risk of falling due to decreased balance and sensation. In our physical therapy clinics, we see thousands of patients who have orthopedic surgeries every year. My own personal experience would say that patients who struggle the most with recovery after surgery are the ones who have circulatory issues. This leads to increased edema in their arms and legs. Edema is caused when your tiny blood vessels called capillaries leak fluid into your tissues. Once it's there, it's not quick to leave, which can lead to a buildup of pressure in the tissues. There are a variety of different medical conditions that can lead to circulatory issues. Sometimes these conditions can be outside your control. In this video, I want to show you 4 low-impact, simple exercises that can make a real improvement in your circulation. I also want to give you some basic information on diet and nutrition that can help as well. First, some foods to avoid or just enjoy in moderation are those high in trans fats, added sugar, or refined carbs. I know this is obvious and probably not groundbreaking for most of you, but I needed to mention it just in case. These foods can lead to increased inflammation and negatively impact your circulation. So what foods should you try to include in your diet? First things first, water. Stay hydrated. Way too many of my patients don't drink enough water. That's right, plain old water. And don't feed me the line, I hate the taste of plain water. Throw a few lemon or orange sections into a pitcher in the fridge and drink at least 12 cups of water per day. Beets are great and rich in nitrates, which your body can convert into nitric oxide. This can help dilate or open up your blood vessels. Fatty fish, such as salmon, trout, or halibut, have a ton of omega-3s, which can help lower your blood pressure and keep your arteries clear. And also, turmeric has natural anti-inflammatory properties, and like beets, can help increase your body's nitric oxide production. Magnesium and vitamin B3 can also help, so make sure you're getting enough either through food or supplements. The last one I'll mention is vitamin C. Eat those orange sections once you drink that pitcher of water, will ya? By the way, please click the subscribe button below. It helps us grow our channel and keep putting out this free content to help you stay active and healthy. Okay, I know what you're thinking. Dude, you're a physical therapist. Let's get to some exercise. Some of you may be very active and walk thousands of steps per day, play a sport like tennis or pickleball, or ride your bike daily. Great, keep it up. Those of you who don't, you may want to consider getting into a routine of doing 20 minutes or more of cardiovascular activity 4 to 5 times a week. First stretch I'm going to show you is called the calf stretch. The calf muscle plays a crucial role in pumping blood through the feet and legs back towards the heart. When calf muscles are tight, they just don't function as well. Think of your calf muscles as a hand pump. You want to make sure they get a full contraction and relaxing in between cycles to maximize the volume of blood moved with every step you take. These are wheel chalks. You can pick them up at your local hardware store, and we'll link to the ones that we use on Amazon. They're pretty cheap. You're gonna start off by putting your feet up on these wheel chalks. The higher you go, the bigger the stretch will be. So depending on how tight your calves are, maybe start off halfway up. If you feel a good stretch, great, stay there. But if you don't feel a good stretch, then you can start to go up a little bit higher until you feel a nice, strong, but painless stretch in the back of the calves. Hold that for 30 seconds. And then when you're done, step down. And as a bonus, let's do some heel raises in between sets. So you're gonna raise up and down on your toes, getting the calf muscles that you just stretched, doing their job again, pumping blood back to the legs. Do 10 of those and go back up for a second set. 30 seconds again, and we're gonna go back and forth between 30 seconds on the calf stretch and 10 heel raises, 3 sets total. The next exercise I'm gonna demonstrate are double knees to chest on a stability ball with ankle pumps. If you don't have a ball, you can do it without one, but elevating the legs up high above the heart can make a difference. Start off lying on your back, legs up on the ball with your toes pointed. As you bring your knees back towards your chest, you want to bring your toes back towards your nose and go back and forth. You don't have to hold this one, just keep the ball moving, but it's important to know that you're not trying to jam the ball back, you're just trying to bring it back under control, pointing the toes when you extend and flexing as you pull back. Repeat this 25 times. What it's going to do is get the blood flowing from your legs back to your heart and hopefully clear up some of that swelling and improve your circulation. Next are bridges. Again, I'll demonstrate with a stability ball to get those legs elevated. However, the ball is optional. You can do the bridges the old-fashioned way with your feet on the floor or a bed, which I'll also demonstrate. We're going to start off with your legs up on the ball. This time, it's a little different. You want to bring the ball back against your thighs a little bit more, just to make yourself a little bit more stable. The key to doing this exercise is we want to get some of the bigger muscles in your glutes and your hamstrings engaged, which will help move blood and improve circulation in your legs. Again, your legs are elevated above your heart, which is going to help as well. You want to keep your stomach tight because the last thing we want to do is rob Peter to pay Paul and injure your back in the process of trying to improve your circulation. So keep your belly tight, use your butt muscles, push up towards the sky. You should have a nice straight line from your knees to your shoulders and then lower it down nice and slow. You're going to repeat that 10 times as long as it's not too tiring. If it is, you can work your way up to that and let it down nice and slow. Take a little break in between sets and repeat that 2 or 3 sets of 10. Without the ball, your feet are down and you want to make sure your stomach is tight. Lift your hips, this time a straight line from your knees to your shoulders, and let it down slow. Lastly, we are going to get upright against gravity. This exercise will work some of the larger muscles in our body, including the hip flexors, the hamstrings, and the glutes, and if you do it right, it can challenge your balance a little bit. You're going to position yourself on a nice, firm, flat surface. If you need something close by to hold on to, do it for safety. You're just going to march up and down. You want to get those hips nice and high. Of course, if you're having any pain in your hip, then you want to back it down, only stay in that pain-free range. But I'm getting my weight shifting. I'm getting nice, large arc motions out of my hips. And again, if you have to, hold on for stability. And you're going to do this exercise at least 15 times or until you hit fatigue on each side. And take a little break, maybe 30 seconds in between, but repeat that a couple sets. All the things we covered today are a great start to improving your circulation and enhancing your health overall. It is important to understand that circulatory problems and edema can be a sign of a more serious condition such as congestive heart failure, liver or kidney issues, or deep vein thrombosis, aka blood clots. So if you haven't already, let your doctor know what's going on. We hope this video was helpful. I know it isn't the most exciting stuff, but man is it important. Be sure to check out this video for some other tips and exercises to keep you moving. Until next time.